All right, let's take you now to this child sex abuse trial. Gerhard Ackerman has denied ever raping any of the young boys and insists they never said no. Ackerman is accused of being a sex ring kingpin and faces over 740 charges, including rape and possession of child pornography. He has been on the stand at the High Court in Johannesburg since Monday, denying any wrongdoing. All right, now let's discuss this. We are now joined via Zoom by Director of the Teddy Bear Clinic for Abused Children, Dr. Shaheda Omar. Dr. Omar, thank you so much for your time this afternoon. I mean, this is a devastating trial. It's very difficult for ordinary citizens to just be listening to some of the testimony that is coming out of court. You know, just talk to us about the impact of such a trial on some of the victims, and I mean, some of them as young as 14.
So, I mean, this is typical of any sexual predator, pedophile, where there's denial of awareness, denial of impact, denial of responsibility. But if you talk about the impact, it's you are so clear when you said it's something unthinkable, it's inconceivable. And for children who have been violated, have been subjected to these heinous crimes, the long-term impact and affecting their trajectory, looking at the issue of being recruited under false beliefs, false expectations, and luring children under these expectations, one looks at the betrayal, the deception, the issue of trust, and being subjected to violation, which lends itself to long-term trauma because they will not be in a position just to pick up the pieces and move on. And of course, they had no control in the situation, but moving forward, one can ask the question, so are they likely to heal? I mean, the answer to that, one can never actually come to a conclusion that they will heal, because at different stages in their lives, it's going to trigger these kinds of feelings, emotions, where they feel totally helpless, hopeless. They were defenseless in the situation and feeling out of control. And of course, forming relationships in the future, one could see that there could be barriers to intimacy, fear of even engaging in relationships, fear of, the anxiety that they would suffer with, the post-traumatic stress disorder, where any situation or setting or resemblance of a person to the people they were abused by would certainly evoke these feelings. They would sit with haunted images, recurrent nightmares, not coping in their daily activities. So, and of course, one can realize that these children, I'm not saying that they will not be normal, but they will not be the same again. One can, project a very shaky future for the children. And of course, they need ongoing support and counseling.
And when you look at, some of the accounts by the parents, one also gets an understanding that this trauma is also extended not only to the victims themselves directly, but indirectly to their families. I mean, one account, and of course he testified in court, was a dad of a 16-year-old who he said he had reservations, before sending his son to Johannesburg, thinking that this in fact was a real job, and speaking to the accused over the phone, for him to just give him that encouragement that this is a legitimate job and his son will be taken care of. But that sheer, realization after years of what happened can also extend to a trauma for families as well.
Indeed. I think what we often see with families is they question themselves for not having taken extra measures to protect their child. And I think that is something beyond a parent's control, because the parent was not purposefully or, deliberately putting their child in that situation. So guilt feelings, racked with guilt feelings, and feeling that they failed as a parent, letting their child down. And again, these are also post-traumatic stress disorders where parents would struggle with this, because anything that they see, every time they see their child, it's a constant reminder. So they may not have been direct victims, but indirectly they are affected. It affects the functioning of the family as a whole. Often families fall apart because of this, and feeling that They fail their child. They have not done what they should have done. They should have checked things out. It's always easy to be clever afterwards, and hindsight is not a foresight. So yes, parents struggle emotionally, psychologically, and it's very difficult for them to come together and pick up the pieces and continue as if nothing has happened. So ongoing support and therapy is definitely needed. And again, one cannot put a timeline to when they would feel healed.
And I mean, we're talking here about 740 charges leveled against this accused Ackerman. And one of the things that you actually think of is the Sexual Offences Act. Can you just talk to us about, why there's just so much misunderstanding? For instance, the accused kept on saying that, yes, of course, the Sexual Offences Act stipulates that the age of legal consent is 16 years you're 16 years old, but then at the same time, anyone under 18 years old in this country is legally considered a child. So when do we really start unpacking and looking at, what adults actually need to know about the differences here of consent?
So you're right when you say the age of consent is 16, and according to SOMA, that's the legal age of consent. However, if we look at the age differences between the 16-year-old, the 15-year-old, and the actual adults, that could constitute statutory rape. And I think the sexual offences legislation does make that clear. But of course, we need to ensure that children are protected. So this piece of legislation needs to be revisited and amended at a future date. But I also want to speak to the fact that serious offences of this nature should never, ever award bail. And there should be stricter conditions and measures to hold these people accountable and restricted of movement. In this case, this is such a heinous crime that no punishment in the world can actually meet the devastation and destruction of innocent lives and vulnerable children and families that have suffered as a result of this offense.
Dr. Omar, thank you so much for your time. Let's leave it there for now. Appreciate you coming on to the show. Director of the Teddy Bear Clinic there for abused children, Dr. Shaheda Omar.